Hello, my name is Sabrina Fabi and I'm a board-certified dermatologist here practicing at Goldman Butterwick Fitzpatrick Groff and Fabi Cosmetic Laser Dermatology. And today we're going to be doing sclerotherapy treatment, which is essentially a treatment for leg veins, which millions of Americans are afflicted by, and many of which actually feel symptoms just from their ordinary little spider veins and the blue veins that people may see. Symptoms such as fatigue at their legs at the end of the day, achiness of their lower legs, tiredness that they may experience. So it does make a difference to be able to treat these leg veins so that we can at least to some degree mitigate the symptoms that our patients feel. And so with FDA solutions that are approved and available in the U.S. market, we're able to treat our patients very easily. And so today you're going to see the treatment of a patient who's 51 years of age and has been afflicted by this condition for many years. And a common misbelief is that patients should wait until they're very bad or wait until after pregnancy to get their leg veins done. And quite the contrary, pregnancy and age and life in general will make them get worse because of increases in estrogen with pregnancy that dilate the blood vessels and make them worse, as well as genetic factors that play host to worsening of leg veins with time. And so because of this, I'd say that at least 90% of patients have some degree of leg veins, and about 50% of those experience some degree of symptoms from their leg veins. And they don't necessarily have to be bulging for one to experience symptoms. And so the younger you are, the better you are at being able to treat these and at least keep them under control. So here we use these tiny little needles essentially to just poke and inject right into the vein. And so you can see the blue vein just going away with the injection. Here at our practice we use foam because it has an increased contact time with the vessel, allowing it to have greater efficacy after treatment. We can't cure them forever, but we can make them better. And if you stay on top of them with treatments perhaps every 3 to 4 years, you can at least keep them small enough so that you don't experience large blood veins or varicose veins that you will see our patient has today who has not had them treated in the past and has now noticed that she has achiness and fatigue at the end of the day from her leg veins. The most important thing we've seen with sclerotherapy and the treatment of sclerotherapy is that afterward patients need to wear compression stockings that we provide here at the practice for them to use 24 hours a day for 7 days consecutively. There are multiple studies that show that when you wear the compression stockings for that amount of time consecutively, you decrease the risk of any pigmentation that can happen along the vessel, and you can optimize the chances for those vessels to improve in just one treatment. Where not all of them will necessarily go away after just one treatment, you may at least see 50% improvement with just one treatment from what we do here in the practice using the foam sclerosants as well as the compression stocking immediately after. You saw that it was painless. It took about 30 minutes to perform, and now the patient can resume their daily activity and go back right to work. One treatment generally with the way that we foam the solution and with the type of medication that we use here at the practice, which are all FDA approved sclerosants. We do not use hypertonic saline, which is associated with more pain, and which efficacy may vary. What you'll see with one of our treatments is that someone can experience up to 50% improvement. Now, of course, if one seeks for perfection, you can always elect to have another treatment, but results will come on over 6 to 8 weeks from the treatment as the body ends up eating the blood vessel that we have now irritated and essentially have closed. And so I'll have a patient come back in 2 weeks just to make sure everything's looking good, and then again at 6 to 8 weeks to see that she has the result that she wants, and she always has the option to repeat the treatment at that time if she elects. The veins will want to come back, open up with time because of genetic factors, hormonal factors, and a slew of other things that contribute, but at least she has the option to always retreat, perhaps 3 to 4 years, to maintain her vessels closed like I've left them today. So if you have any questions, you can always come to the practice for a complimentary consultation to get your leg veins evaluated to see if they are right for treatment.